Have you noticed your knees aching more than usual? Maybe your hips feel stiff when you get out of bed in the morning? If that sounds familiar, stay with me. What I'm about to share could change the way you think about food, pain, and aging. The vegetables you believe are keeping you healthy might be quietly contributing to the joint pain that steals energy, freedom, and simple pleasures from your days. I'm dietary Linda Francis, and I've spent years helping people reclaim mobility and confidence. Today, I'll walk you through exactly which 3 vegetables you should be cautious about after age 60, why they impact joints more strongly as we get older, and most importantly, how to replace them so your meals stay delicious, nutritious, and joint-friendly. This is not fear-mongering. This is practical, evidence-informed guidance you can act on tomorrow. Think about the last time you hesitated before standing up, or avoided a walk because your knees felt unreliable. That hesitation chips away at life. Fewer walks, fewer social outings, less time playing with grandkids, smaller worlds. We often assume pain is just age, but many contributing factors are within our control. One of the biggest overlooked influences is diet. Not in the broad sense of calories or weight loss, but very specifically in the chemical compounds some vegetables contain that can drive inflammation in vulnerable bodies. When you're young, your body handles some of these molecules more efficiently. After 60, enzyme production, liver function, and detox pathways begin to slow for many people. Compounds that once passed harmlessly through the system can linger and concentrate where they do the most damage, in joint tissues. Let's be clear, not all vegetables are bad. Far from it. Vegetables are essential. The problem is nuance. Certain plants contain molecules that some older bodies react to in ways that promote swelling and slow repair. 3 vegetables stand out as the ones I see most often on the plates of people with chronic knee and hip soreness: tomatoes, bell peppers, and eggplant. These are members of the nightshade family, and they contain compounds that can, for some people, trigger or worsen joint inflammation. I want to explain how, why, and what to do about it, step by step, with concrete substitutions, realistic timelines, and simple tools so you can judge the results for yourself. Tomatoes are everywhere. They're in pasta sauces, soups, stews, ketchup, and many processed foods. They're praised for lycopene and heart benefits, and those benefits can be real for many people. But tomatoes also contain compounds that some aging bodies struggle to neutralize. When those compounds accumulate, they can stimulate immune activity in joint tissues. The consequence: more swelling, more stiffness, and more of that grinding, discouraging ache when you move. I once worked with a woman who, after decades of a tomato-heavy diet, noticed that cutting back on tomato sauces and ketchup led to meaningful reduction in morning stiffness within 3 weeks. She hadn't expected such a clear change, neither had her doctor. This is the sort of real-world signal we pay attention to. Bell peppers are colorful and marketed as a vitamin C powerhouse. They are delicious, versatile, and visually beautiful, but they're also nightshades. The sweetest, reddest peppers tend to have higher concentrations of the molecules that can interfere with cartilage repair in susceptible people. That doesn't mean every senior will have a problem with bell peppers, but I've seen enough clinical stories and lab data to treat them seriously when joint pain is the chief complaint. For people who regularly eat salads loaded with red and yellow peppers, or add sliced peppers to sandwiches and stews, that daily exposure can mean repeated inflammatory signaling, which is the last thing a joint trying to heal needs. Eggplant is the one that surprises almost everyone. It's praised for being low-calorie and fiber-rich, used as a meat replacement, and celebrated in Mediterranean diets. However, eggplant contains a higher concentration of certain nightshade compounds than many other commonly consumed vegetables. Those compounds are relatively stable during cooking, which means grilling, baking, or frying, won't reliably neutralize them. People who switch to eggplant-heavy meals to reduce meat often do so with the best intentions. But for sensitive joints, it can be a hidden culprit. Clinical reports show that when eggplant is removed from the diet, Some people experience faster reductions in inflammation than with other food changes. The difference can be dramatic. If you're thinking this sounds dramatic, it's because it can be, but it's also manageable. The first step isn't panic. It's a methodical, patient experiment. I encourage you to approach this like a scientist of your own body. Remove, replace, measure, and decide. Start by reducing your consumption of these nightshade vegetables. Cut back gradually if that's easier for you. Reduce from 9 exposures per week to 5, then to 2, and then remove them for a test period of about 30 days. Keep a simple journal. Rate pain on a 1 to 10 scale each morning and evening. Note stiffness when rising, and record practical mobility tasks. Can you climb stairs without pausing? Can you rise from a chair without bracing? These are the measures that matter. While you do the elimination phase, replace nightshades with joint-friendly vegetables that provide the nutrients you need without the inflammatory triggers. Cruciferous vegetables, broccoli, cauliflower, Brussels sprouts, contain compounds that help dampen inflammation. Leafy greens like kale, spinach, collards, and Swiss chard supply magnesium, vitamin K, and other minerals crucial for cartilage health. Berries, cherries, and grapes offer high antioxidant power that supports tissue repair. Citrus fruits, kiwi, and strawberries give you vitamin C without nightshade risk, and they support collagen synthesis, an essential process for joint tissues. Make practical swaps in your kitchen. If you typically make spaghetti with marinara, try a creamy avocado basil pesto or a light olive oil, garlic, and lemon sauce with added sautéed mushrooms. If you love fajitas, use onions, mushrooms, zucchini, and thinly sliced carrots to recreate the texture and flavor profiles. Substitute portobello mushrooms or cauliflower steaks for eggplant as a hearty main course. Swap ketchup for a mustard-based or herb vinaigrette. Check prepared foods carefully. Tomato paste hides in canned soups, stews, and condiments. The goal is not restriction, it's substitution. Keep your meals satisfying and flavorful while removing the specific triggers. Expect a timeline. Most people report early signs of change in 2 to 3 weeks. Less stiffness on the first step out of bed, fewer interruptions during walks, and modest reductions in pain. More pronounced benefits often appear around 6 to 12 weeks. That's because your body needs time to clear accumulated compounds and to rebalance inflammatory signaling. Some people notice very fast change, others take longer. That variability is normal and why the personal experiment is essential. If, after a full 30-60-day elimination, you notice meaningful improvements, you'll have strong evidence that nightshades were contributing to your symptoms. You can then make an informed decision about reintroducing them occasionally or avoiding them long-term. Don't go it alone. Talk to your doctor before making major dietary changes, especially if you're on medications. For example, some anti-inflammatory supplements and herbal therapies can interact with blood thinners or other drugs. If you and your clinician decide to reduce or stop a pain medication, do that under medical supervision. The goal is safer, more sustainable joint health, not sudden medication changes that could have unintended consequences. A practical 90-day plan helps many people stay on track. Week 1, a kitchen audit. Pull pantry staples and ready meals that include tomato products, pepper paste, salsa, or eggplant-based sauces. Replace them with alternatives, olive oil-based dressings, lemon and herb sauces, or high-quality pesto. Week 2, commit to 3 nightshade-free dinners. Make them delicious. Roasted cauliflower with turmeric, lemon and thyme salmon, mushroom stroganoff with whole grain pasta, hearty lentil and spinach stew. Week 3, expand the swaps to lunches and snacks, salads with berries instead of tomato-heavy bowls, hummus with cucumber and carrot sticks, and fresh fruit for dessert. Weeks 4 to 8, continue elimination and journal daily. Track pain, mobility, sleep quality, and energy. Note any tendencies. Do you sleep better? Are you reaching for pain meds less? Weeks 9 to 12, Compare your baseline and current measures. If improvements are clear, decide whether to reintroduce one nightshade at a time in small amounts and monitor for a return of symptoms. If reintroduction causes flare-ups, you've learned something powerful about your body. Beyond diet, combine these changes with simple lifestyle supports that accelerate progress. Hydration matters. Joint cartilage is largely water, and chronic dehydration can make cartilage less resilient. Aim for consistent fluid intake throughout the day, not just a big glass at night. Gentle movement is essential. Walking, swimming, or low-impact cycling help circulate synovial fluid and nourish cartilage. Strength training for the muscles around the knees and hips reduces joint load. Even short daily routines of 10 to 15 minutes of targeted strength and balance work protect joints and reduce pain over time. Add anti-inflammatory spices like turmeric and ginger to foods. Small daily doses can have measurable effects for many people when absorption is optimized. For turmeric, a pinch of black pepper increases uptake. Prioritize sleep. Restorative sleep supports tissue repair and lowers systemic inflammation. Let's address a few myths that keep people stuck. Myth: joint pain is inevitable and untreatable. Not true. While age changes the body, chronic disabling pain is not an inevitability. Many factors that drive pain are modifiable. Myth: rest is best. In chronic inflammatory joint conditions, gentle, consistent movement is far more effective than long periods of immobility. Myth: all plant foods are equally beneficial. Again, nuance matters. Some plants are powerful healers. Others contain compounds that, for certain people, can worsen inflammation. If you try the nightshade elimination and nothing changes after 60-90 days, don't be discouraged. That information is valuable. It means your joint drivers might be different, perhaps structural wear, metabolic inflammation, autoimmune triggers, or other dietary elements like added sugars and refined grains. Use what you learn to refine the next step with your clinician or a registered dietitian. I want to give you practical recipes and swaps that make this doable. For instance, an easy pesto for pasta. Blend a cup of fresh basil, 1/4 cup of walnuts or pine nuts, 2 tablespoons of nutritional yeast, the juice of half a lemon, a garlic clove, and enough extra virgin olive oil to reach your preferred consistency. Toss with whole grain pasta and steamed broccoli for a filling, anti-inflammatory dinner. For a morning boost, make a ginger turmeric tea. Simmer a 1-inch piece of fresh ginger and a 1/2 teaspoon of turmeric in 2 cups of water for 10 minutes. Strain and add a squeeze of lemon. Drink it warm. It supports digestion and provides gentle anti-inflammatory support. For a hearty main, try portobello steaks. Marinate large portobello caps in olive oil, balsamic vinegar, garlic, and rosemary for 20 minutes. Then grill or roast until tender. Serve with a side of roasted Brussels sprouts and quinoa. These swaps keep flavor, satisfy hunger, and intentionally avoid nightshades. There are important safety notes. If you have a diagnosed autoimmune condition, speak with your rheumatologist or primary care physician before making major dietary changes. Some autoimmune patients find nightshade reduction helpful, but it's best done with oversight. If you have diabetes, monitor blood sugars as you shift carbohydrate choices. If you're on anticoagulants, check interactions before starting new herbal supplements. Above all, don't abruptly stop prescribed medications without medical guidance. The path to reduce medication often comes after sustained improvements, measured and supervised. Let's talk about motivation and mindset, because that's often the difference between trying something once and committing long enough to see change. Treat this as an experiment, not a judgment. Approach it with curiosity and compassion. The first week may feel inconvenient. You might miss favorite dishes. That's normal. Plan meals that excite you. Involve a friend or family member. Change is easier together. Celebrate small wins, an easier step, fewer nighttime awakenings, a more relaxed walk around the block. These wins are the data points that confirm you're moving in the right direction. If you want to track progress in a focused way, create a simple daily checklist: morning pain rating, number of minutes walked, medication usage, hydration goal met, and one joint-friendly meal eaten. After 30 days, review trends. You'll see patterns. Maybe pain reduces on days you hydrate well and move more, or perhaps certain social meals cause flares. That insight is powerful. It moves you from being at the mercy of pain to being an active manager of your health. Now, imagine 3 months from today. You wake up, and the first step out of bed is not met with immediate alarm. You decide on a spontaneous walk because your knees feel steady. You bend to lift a grandchild without calculating how you'll stand back up. These are not small things. They are the daily freedoms that create a life worth living. Changes like altering the kinds of vegetables you eat may seem modest, but the cumulative effect, combined with movement, hydration, and the right sleep, can be transformative. Before I finish, I want to be explicit about one more thing. The science is evolving. Not everyone will react the same way to nightshade vegetables, and some of the compounds in these plants have health benefits for many people. The point is personalized action. You are the primary investigator of your own body. Use experimentation, good record keeping, and accountability with your healthcare team to determine what works for you. If this message resonated with you and you're ready to try a 30-90-day experiment, start today by scanning your pantry and fridge for obvious sources of tomatoes, bell peppers, and eggplant. Make one substitute for dinner tonight. Keep a pain and mobility journal. Commit to 2 10-minute gentle movement sessions daily. Hydrate. Add a ginger turmeric beverage to your morning. Small, consistent choices build momentum and lead to big change. If you found this helpful, please like this video and share it with a friend or family member who might be silently suffering. Drop your age and one change you'll try in the comments. I read every single message, and your story could encourage someone else to take that first step. If you want to go deeper, watch our next video where I expose 5 common medications that can weaken bone density and what safer alternatives or supportive strategies you and your doctor can consider. Don't forget to subscribe and hit the notification bell so you don't miss it. This is about more than food. It's about freedom. The freedom to walk, to play, to travel, to laugh without bracing for pain. You deserve a life full of movement and joy. Start the experiment. Track what happens. Partner with your clinician. Be patient and persistent. I'll see you in the next video. Like, share, comment, and watch the next one. And together we'll keep building a future where age doesn't mean limitation, but opportunity.